दर्शकों, पंजाब प्लस चैनल पे आपका स्वागत है। आज हम आए हैं डॉक्टर लीनू गुप्ता। दर्शकों, पंजाब प्लस चैनल पे आपका स्वागत है। आज हम आए हैं डॉक्टर लीनू गुप्ता, एक ऐसा नाम जिन्होंने क्रिएशंस की हैं और लंबे समय से अपनी सेवाएं दीप हॉस्पिटल में दे रहे हैं एज ए न्यूरोलॉजिस्ट। डॉक्टर साहब, स्वागत है आपका हमारे स्पेशल शो में।
Thank you for welcoming me on your channel, and it's a regard from your side that you have given me this chance to speak on your channel.
Dr. Leenu, you have started your career from last, I feel, 10 years, and you are really working hard and very smoothly. And in Deep Hospital, you have saved so many patients. What will you say?
I have been working in Deep Hospital since August 2016, and it's been 8 years that we are serving here. We have different stroke unit. We are dealing with epilepsy patients. We have free clinic also on one day when we are doing poor patient. We are seeing poor patients also, and every day, like in an OPD of 20-25 patients OPD, we are seeing patients, and so we are serving since last 8 years. I am serving this hospital.
And as far as emergencies are concerned, this is really a great hospital where thousands of patients are surviving in the very critical conditions.
Yes. So because the stroke patients are all when they present in the emergency, they can present in a critical condition also, they can be presentable in a stable condition also. So the critical patients, we have state of art ICU care services in the hospital, which are very good, seen by an intensivist, and there are 24/7 EMOs, emergency medical officers are there. Our staffs are very well trained. We are taking regular classes for the training of the students and the staff.
This hospital is boon for those patients who are from blood tumor, who are from brain tumor, and who are with high strokes. What do you say?
Usually we are specializing in, I am specializing more in stroke. So whenever patient comes in a window period of 4.5 hours, so we give a blood thinning drug which cause survival of the patient. And brain tumors also we are seeing, the urgent surgeries if they need, so we do it, and brain hemorrhages also, and acute conditions like very severe headaches and the refractory epilepsies we have doing it. And once we have done one very rare case of epilepsy in the hospital, one epilepsy surgery we have done 2 years back. It was the first epilepsy surgery in North India, because most of the epilepsy surgeries they are done in South.
Plus, in cases of strokes, we often see that people give the opium to the patients. What will you say about that?
There are few studies which are conducted by Dr. Gagandeep in DMC ki opium, if we are giving opium to the patient, whether they improve or not. Few patients who have very small clots, they do improve, but it is not documented anywhere to give opium.
And what will you say, as you have said, 4.5 hours? What will be about that time management?
Time is a precious moment at that time. The relative should notice whether the person is having any arm weakness, leg weakness, facial weakness, or there is slurring of speech, because if they waste a single second, the brain cells they die. Millions of brain cells die within few seconds. So the time management is very important, and few patients they usually give opium which is not indicated in the acute phase of the stroke. So you don't have to go to the quacks, so that the patient should not be suffering, and the clot size should not increase in the brain. So they should come to the hospital where there is a tertiary stroke care unit.
If they are not able to come in 4.5 hours, what do you say?
There are few studies in which it is written if the clot has not developed on the MRI scan. There are few sequences on the MRI scan. If the clot has not developed on that, so we can still thrombolize the patient. We can still give that blood thinner agent, but usually we avoid, because the risk of bleeding with the blood thinner agent is 15%, 13 to 15%. So we can manage conservatively with the antiplatelets and statins and anticoagulants.
And as far as Dr. Leenu, you are concerned, you are doing these services from last 8 or 10 years. What will say that experience counts much. At that time when you started your practice, there are not so much of advancement, but now as the time passes, new advancements are here.
Yes. So if the patient, if we are thrombolizing a patient, if we are giving blood thinning agent in 4.5 hours, still the patient is having the symptoms recurrence. So there are newer studies, and so we can like there are blood vessels here in the neck from where the clots they go to the brain. So we can put a stent here in the carotids. These are called carotids. So carotid we can put stents, and this is a new thing which is like the new intervention which has come in the market.
And you are doing that also?
No, that is done by a neurosurgeon.
Dr. Leenu, you have given us the time. Thanks a lot for that. What will say that in the present scenario when people are stuck to their offices, online work is done, and they are taking fast foods, what will say these are the causes for these strokes?
Yes, because there are two type of factors. One is modifiable factors and other are non-modifiable factors. So these are all modifiable factors are age, sex. Then third thing is the food, alcohol, smoking, and the lifestyle modifications. These are very important in day-to-day life, because if lifestyle modification is not there, there is no walking, there's no, obesity is there, obstructive sleep apnea is there, so they have more chances of developing stroke. So lifestyle modification is a must. Junk food should be avoided.
As far as hypertension is concerned, people are now in high blood pressure and they don't care for that. What do you say?
The awareness is very important. Day-to-day practice. The risk factors mainly which causes stroke are diabetes, hypertension, dyslipidemia. So they usually have to control these risk factors. So they have to get a regular checkup done. They have to reduce the salt intake. Every month they have to get a blood sugar testing done, blood pressure testing done, and every 6 monthly they should get a full blood checkup done.
Dr. Leenu, you have given us a valuable time. Thanks a lot for that, and thanks to Deep Hospital where you are serving. Thanks a lot.
Thank you so much for making me part of this intervention. Thank you so much.